All right, well, welcome everybody. Thank you very much for coming to this meeting. So to those of you who don't know me, my name's Jackie Appleby. I'm a GP in Tower Hamlets and I chair Doctors in Unite, which is the doctors branch of Unite the Union. Other speakers will be talking about the campaign that we're running, but thank you very much for joining this meeting, this very important meeting this evening to end the commercialisation of the NHS, get Centene out of the NHS. You'll hear all, if you don't know the story already, you'll hear all about it during the meeting, and then I'll talk a little bit at the end about some actions we have to keep the campaign going and the sorts of things we need to be doing. But without further ado, sorry, and the way the meeting will run, there'll be 10 minutes for each speaker. We've got Richard Buckwell, who is the chair of NOTS KONP speaking. We've got Dr. Louise Irvine, who's a GP in Lewisham and involved very heavily in Cllr NHS Public and health campaigns together. We've got Rabina who's a councillor, Liberal Democrat councillor in Tower Hamlets. We're hoping to have Antonio Perez Iranzo, who has been involved in the campaign against Centene in Spain, to tell us about their experience there already. And then finally, Jeremy Corbyn, who needs no introduction. Thank you everyone for coming. Speakers will have 10 minutes each, no more, and then there'll be time for a discussion from the floor. We aim to finish at 7:30. So thank you very much, everyone. I'd like to hand over to Richard Buckwell, who is chair of NOTS KONP. Thank you, Richard. Oh, and can Maggie or Campus unmute Richard? Thank you.
Right, that's better. Hello, I'm Richard Buckwell. I'm, as mentioned, chair of Nottingham and Notts NHS Public. You might wonder why I'm starting off from Nottinghamshire. I'm sure quite a lot of you are from London. Well, you'll find out very soon. To start off, in October 2015, Centene got their introduction to NHS England when they were invited to an event co-organised by NHS England about something called New Care Model Programme. This was led by a certain Samantha Jones, and you might hear a little bit more of her later tonight, and the NHS Confederation. And moving swiftly on from this, early 2016, Nottingham became a pathfinder, in layperson's terms, a pilot, for introducing this New Care Model Programme, which soon became to be called Sustainable Transformation Programme. Some of you might have heard of, but with all these acronyms you get in the NHS, it is now very much what is called the Integrated Care System. Central grant funding was to pay for this consultant, and guess the name of the consultant employed and promoted at no local cost to the NHS, and this was called Centene. So who are Centene? There are further details I'm going to post in the chat when I've spoken. Two very good articles from Stuart Player, who had them published by the Socialist Health Association. But there are some important points you need to know about them as I talk. Many of you will only first heard of Centene earlier on this year with the GP takeovers in London. But Centene are a US health insurance company now with an annual income of 2/3 the income of our NHS, so they are big. They made a great leap forward as a company under Obamacare and became the market leader in the US Medicaid managed care. And this private sector administration of state services for particularly the poor, pregnant women, the elderly adults, and people with disabilities. And there are huge similarities between Medicaid managed care and integrated care systems. So how do they make their money? Stuart expands on this, but I'll just go through it very briefly. First off, reducing the quality of care. Well, nothing new there. Secondly, control of the regulatory environment through political lobbying, donations, and a revolving door between the state and corporate institutions. So again, nothing new. Failure to comply with regulations, I think some of these were listed on the flyer. Reduced reimbursement rates to medical providers, minimising provider networks, exclusionary contract language, much of the language the NHS use, I think, could be counted as this, and reducing and denying care, particularly for the most expensive patients or most expensive care needed. There are plenty more examples documented by Stuart, and I'm sure some of them will come up tonight, and I'll probably refer to some of them as we go into the discussion about what they're doing here. But back to the Notts experience. Before their appointment, we got wind of their record in Spain, and hopefully we'll be hearing more about that, where they got a 90% shareholding in a Spanish company called Rabina Salud. And they had a contract with the Valencia Regional Health Authority, but their performance was poor and it was taken back in-house. So as a group, we campaigned locally when we heard about their possible appointment, saying, why on earth are we appointing a privateer whose services have had to be taken back in-house? And what were they going to do in Notts? Well, as an insurance company, they intended to carry out an extensive analysis of all the work streams the NHS provided locally. And I'll list some of these so you can see what areas of work they were going to be looking at. Patient pathways, population health management, social care integration, IT services, provider payment models, together with governance and contract design, all absolutely vital to providing not just a local health service, but to providing a health service anywhere in England. And clearly a Trojan horse, not just for us locally, but for everyone nationally. And it is no surprise that the lead Chief Executive for our ICS, David Pearson, has now become a central NHS advisor. But like many other integrated care systems, since being drawn up, there hasn't been a lot of evidence of what they've delivered. Delayed initially, pleased to say, by KOMP's judicial review over lack of consultation, their lack of statutory footing, which the government hoped to remedy from their point of view in the new health bill. And there are many impossible dreams of cutting beds to fund community care at the same time the NHS was going through its usual health emergencies with A&E clogged to the rooftops. And then, of course, we were hit by COVID 18 months ago. So you might have not heard what was happening, but Centene was stealthily getting on with things in the background. And this came to a head in Notts last November. There was a contract for a surgery called Platform 1 in Nottingham city centre. It's an extremely good service. It's been running 10 years, but the CCG said they could no longer afford to fund it the way it had been funded, despite it having an outstanding assessment by the Care Quality Commission. It was extremely well thought of, but the new contract was only going to offer 40% as the funding they already had. And the CCG refused to share its equality impact assessment. And when we did get it, it showed that every protected characteristic required for an equality impact assessment would be worse off under the new funding arrangement. There was outroar when it was taken to the city's Scrutiny Health Committee. GP spoke out, Health Watch spoke out, quite unusually, the voluntary sector up in arms, and there were articles in the BMJ magazine and other national publications. And it was during this process that we identified that Centene might well be one of the companies bidding to take it over. And we discovered and heard about operos that they set up to take over GP surgeries, and discovered they'd set up 5 in Nottingham, in the last 18 months we hadn't realised. All in poor areas. Some of these surgeries didn't have GPs on their staffing and still don't have GPs on their staffing. They're served by locums as and when they need them. And they have 3 more contracts which are due to come up at the end of this month very soon. And we've heard one of them has already been taken over by Centene. So they were gunning to take over services. The scrutiny panel demanded they come back in December and provide a further report. They did come back in December, but, and this is what regard they had for democracy, they had already awarded the contract. Fortunately, because of the uproar, not to Centene, but to the local federation of GPs, but they've still got to cope with a 40% cut in funding. And also, as part of the measure to make this new surgery work, 3,000 of the 11,000 patients have been dispersed to other GPs, despite the fact that they chose to join this surgery in the centre of Nottingham. So the CCG have no regard for listening or democracy, and this is a big worry about what's going to happen in the new health bill with the ICSs. It can only get worse. But it does show that if you speak up and campaign against these things, you can prevent Centene having an inroad. And I think I want to finish on a positive note that we've had experience in Nottingham of campaigning on issues. We stopped Centene getting this surgery. We wanted to stop getting more. But we've also stopped other privateers developing in Nottingham. We're pleased to say we got rid of Cllr when they managed major surgeries in our hospitals. And that was after a really innovative campaign with Unison Unite. We also got Cllr taken out of the treatment centre, which they'd run since inception. And again, something we only discovered afterwards, Cllr are 40% funded by Centene. So there are great worries here. But again, looking on the positive side, the thing about GPs, all of us need and use GPs. They're a service everyone uses. There's a service that can unite our opposition to what is happening to the NHS at the moment. And I urge you all to campaign locally, exposing the predators that Centene are. So I'll leave it at that. Happy to answer any questions later on. Thank you.
Thank you very much, Richard. And it just goes to show, as you say, that if you fight, if you fight, we can have victories. And it's really, really important to fight so that we don't, we push back against this. So thank you very much. So our next speaker is Dr. Louise Irvine, GP in Lewisham and a fantastic NHS activist. So thank you, Louise, for joining us.
Thank you for inviting me to this meeting, and thank you, Richard, for that very interesting account of what's happening in Nottingham. I've had to cut my speech a bit. There's so much I could have said, so I've taken out bits that I think other speakers are covering, and if I don't cover something, hopefully I can answer in the questions. So just to recap, in February, campaigners discovered that Oprah's Health, a subsidiary of the US health insurance giant, the Centene Corporation, had taken over 49 AT Medics GP surgery sites in London and the South East. So across England, Centene now control 58 practices, covering 500,000 patients, making them the largest providers of primary care in the English NHS. The method Oprah's used to take over the practices was to take over the holding company that owned AT Medics. They replaced the directors of AT Medics with Oprah's directors, including Samantha Jones, who Richard mentioned, who was at that time the Oprah's chief executive. She then resigned a few weeks later and is now an advisor on health to Number 10. Talk about a revolving door. Patients and campaigners backed by local councillors and MPs have since mounted a wave of protests outside local surgeries, as well as targeting the headquarters of Oprah's Health on the 22nd of April. Keep Our NHS Public, 999 Call for the NHS, We Own It, and numerous local NHS campaign groups have been involved. Another day of protest is planned for the NHS anniversary on the 5th of July. In May, lawyers for Islington patient and councillor Anjana Khurana filed a claim for judicial review against NHS commissioners for allowing Oprah's Health to take over these NHS contracts. Her case is backed by Keeper NHS Public and 999 Call for the NHS. We're still waiting to hear if a judge will give permission to go forward to judicial review. The case is based on three main areas: lack of consultation, inadequate due diligence into Oprah's financial standing, and lack of information on what Oprah's will do with patients' medical data. There have been so many battles in defence of the NHS and many more to come, but it's clear that GP surgeries are now a key battleground in the privatisation of the NHS. General practice is different from the rest of the NHS, but it is not true to say it is all private anyway, so it doesn't matter who owns the contracts. Traditional general practice is run by GPs, and the income they get goes towards their pay, staff pay, and running the practice. There's no profit for shareholders. From 2004, legal changes to GP contracts meant that for the first time, private companies could get contracts to provide GP services. The contract that was seen as the gateway for the commercial sector into general practice was the Alternative Provider of Medical Services contract, known as APMS. Unlike traditional contracts, anyone with no previous experience of providing GP services can get an APMS contract. The majority of Oprah's GP contracts are APMS contracts. There's a world of difference between traditional general practice with community-based GPs providing personal, continuing care, and a giant remote commercial company such as Oprah's. Oprah's is owned by Centene Corporation, a US health insurance giant. Oprah's is a loss-making company that is financially dependent on Centene Corporation. For example, Oprah's 2019 accounts show that it made losses of nearly £7 million, such losses being set off against future profits. In the same year, it received cash funding of £9.5 million from Centene. The 2018 and 2017 accounts also show Oprah's operating at a substantial loss with huge cash funding from Centene. Needless to say, Oprah's losses mean it doesn't pay UK tax. Oprah's has no existence without Centene and is Centene's foot soldier for its incursions into UK healthcare provision. Centene Corporation itself is worthy of a closer look because of its history of fraud, inadequate coverage, and poor quality healthcare in the US. It does not engender any confidence in its integrity or suitability to provide UK health services. There's no guarantee Centene will continue to fund Oprah's, especially if it continues to be unprofitable. Oprah's business strategy stated in its accounts is to divest of activities that have not met profitability targets. As a result, on the 31st of March 2019, Oprah's Health Limited exited the Surrey and Borders Partnership NHS Trust Child and Adolescent Mental Health Care contract. At the end of June 2019, it exited the Surrey Borders Partnership CFHS contract. And in July 2019, it divested its complex care service division. It's hard to profit from general practice without operating at scale and downskilling and downsizing staff, because the only way to make a profit is to cut your costs, especially staff. And in particular, replacing GPs and nurses with less skilled and less costly health practitioners. This is unpopular with patients. They prefer the traditional model based on continuity of care with a known GP. This model is in danger of being swept away by the new kids on the block, huge profit-seeking corporations like Oprah's Centene. However, given the difficulty in profiting from general practice, as seen by the exiting of many other organisations that tried, it's likely that Centene has other interests in this area. For example, use of patient data in developing population health management programs. Centene's CEO has said that Centene is a, quote, technology company focused on healthcare, unquote. And with the health data of 500,000 patients, there's plenty to play with. Another could be opportunities to develop integrated care systems, given Centene's interest in such systems, which Richard explained, with its stake in the Ribera Salud Alzira Accountable Care organisation in Valencia, Spain. The Alzira model, interestingly, it's been lauded by UK health leaders as a model for integrated care systems in England, which upcoming legislation will make into statutory bodies. Incidentally, Centene's Spanish ACOs have now been taken back into public ownership, which suggests they did not fulfil early promises of improved care. Whatever the reason for Centene's interest in acquiring dozens of GP practices, the scale and nature of the takeover is a major change in the way GP services are being organised and delivered, and is the shape of things to come unless we oppose it. To campaign against this, we must publicise what's happening through public protests, petitions, local press and social media. When patients find out, they're very angry. General practice is close to people's hearts. Our JR fundraiser raised over £40,000 in about 4 days, which just goes to show how popular this cause is. We hope our JR will go ahead, but even if it does not, there's still much to be done. We must challenge each and every instance of APMS contracts coming up for renewal and demand that there's local patient and public consultation on the kind of organisations who should be allowed to run our GP services. We must campaign against the upcoming NHS bill and in particular against integrated care systems. Specifically on general practice, we should campaign for amendments in upcoming legislation to abolish APMS contracts. This would not be sufficient, but would be a good start. General practice is in crisis, underfunded and understaffed, which is why so many smaller, struggling practices were vulnerable to corporate takeover. We must ensure we include general practice in all our campaigns for proper funding for the NHS and proper pay for NHS staff. Cllr NHS Public is working on a charter for general practice and will be including general practice in our updated rescue plan for the NHS to be launched in the early autumn. This is only the beginning of our campaign to defend general practice and kick the corporates out. Thank you.
Thank you very much, Louise. And it was a really comprehensive sort of description of what's happening. And thank you very, very much indeed. And I think, as Louise says, these APMS contracts have to be taken on. So wherever you are, if you've got it, if you're active in your local health activist group, KONP, you know, fantastic. If you're at this meeting and you're not a health activist but you want to become one, there's probably going to be a group very near you. If you go onto the Cllr NHS Public website, you can see. And if there's not one, just get a couple of friends together and make one. Just set one up, because you know, we need these things challenged wherever they are, and they come up. They will come up regularly over the years. The contracts are time limited, 10-15 years, so they will be coming up at a GP surgery near you soon, I am sure. Okay, just to say, Richard, thank you. You put some articles in the chat. The chat isn't enabled for everyone, so Stuart Player's article that Richard recommended is on the Socialist Health website, sochealth.co.uk, and it's Stuart Player, Centene, the real agenda, what to expect. So if you want to look that up, please do. Okay, so thank you very much. So Louise, and then the next speaker is Rabina Khan, who is again very active in NHS campaigns. She's always out with us in Tower Hamlets when there's anything to be campaigned for with respect to the NHS, and she's a Liberal Democrat councillor in Tower Hamlets Council. So Rabina, thank you very much for joining us, and good to hear what you've got to say.
Thank you, Jackie. Thank you for inviting me here. And I wanted to speak to you, not just as a councillor, but as from my lived experience of using the GP, and also standing up for people who are using GPs owned by some of these contracts. So Louise gave a really good account of a GP practice, and also referred to the practices, 58 practices. Well, one of those practices is my GP, East One Health, and I was out there campaigning outside East One Health. And the reason I'm so passionate about this is because I've seen firsthand the effect of these privatisation by stealth, the impact on the lived experience of patients. So let me just give you a little example of my own self. I didn't know that these contracts were coming in. I didn't even know that this was happening, and I'm a councillor. And it came gradually, bit by bit. And it happened under the lead up to COVID, under the pandemic, when people wouldn't have been aware. I had COVID. I had I'm a long-term COVID sufferer now. I had a very serious COVID back in December. And just before I fell ill, I started getting these pains on my left arm. And I kept asking for an appointment with my GP. And it was, you'd ring up in the morning at about 8:30, and you'd be on the phone for about half an hour, 45 minutes, up to an hour, trying to get this appointment with East One Health. And me, as someone who can access the phone, it's easy, but for someone who's not who's elderly, who might have a disability, the impact on that person is enormous. And so eventually, when I did get an appointment, you can immediately feel that this isn't the same GP or the same practice I had. It was, well, you know, we'll give you a call back, we'll give you a consultation. And I just wanted to give you a back history of East One Health. 30 years ago, I moved to the borough, 91, and the East One Health was originally Bernardo Gardens GP surgery. It's the old-fashioned kind of traditional concept of care and seeing someone face to face, someone you knew. It was continuity of care. It was the receptionist you knew. You rang on the day and you could get an appointment on that day. And I still remember how Dr. Basu, who ran it from a flat in Bernardo Gardens, that eventually moved on. It was regenerated, that area, and it went to Cable Street Surgery. And that is how it all, you know, that's the back history of it. And I've seen this practice go from this little flat onto becoming East One, and now it's privatised. And we, as the patients and as a councillor, I can see what's happening. I have, for example, a constituent very, very desperate to be in contact with the GP because her husband has a disability. We need the support of the GP to verify his condition so that I can put forward a housing case. She's been unable to get an appointment because she's been told several times you have to ring the next day. If you're in the queue, then we'll be able to give you an appointment, or we might give you a call back. Today, I campaign on cladding as well, and I met this gentleman who's 83 years old in my ward, and he said to me that he took care of his wife. She had dementia because he was so fearful of what the NHS had become and what social care had become that he would rather give that care himself. An 83-year-old man looking after his wife. She passed away a few years back, and what that brought to me, as I thought about this evening's meeting, is the way it's affecting older people, people with disability, people whose first language is not English, to access that traditional good care at the GP. I was talking to my mum a few weeks ago, and she said there was a time that a GP would make that call to your home, would make a visit. Okay, I understand it's COVID, but they don't do that anymore. That's not what the NHS was about. The NHS was about making sure there was compassion, there was a sense of careness in delivering that service, and that's not happening. And I'm going to give you an example. As a patient of East One Health, I got this letter, and I'm happy to share it with people. And in the letter, and my whole family got this letter, my daughters, my husband, my children, you know, they all got it. And it talks about important information about your practice, about East One. That's going to move to Goodman Fields Health Centre. And it's asking us, and I can read this letter, to go on and find out more in a drop-in session with Zoom, through a Zoom. And first of all, some of the elderly people who are going to get this letter don't know how to access Zoom. Secondly, people whose first language is not English, who find it hard to access services, they won't know how to access Zoom. I mean, Zoom is a new way of working. We're all trying to get accommodated with it. In the letter, it also says, what does this mean for me? It means that your healthcare will be provided from much better quality premises. Okay, I accept that. We're going to move into a new health centre, brand new health centre. It will allow the practice to expand the services delivered over time and have more clinicians to help you with your health. It will mean the practice will be able to offer patients the choice of seeing a wider range of team members to support their health and social needs. That looks like a really good package. In reality, I don't believe that's the case, because if it was the case, they would have made a really big effort to consult with elderly people, to consult with very vulnerable people. And when this letter talks about, we will expand these services, it's not telling me, will it cut back on the waiting time? Will it cut back on making sure that we can, where we don't see GPs, that we can see GPs? This is, to me, is what someone from a private industry would send out. It doesn't give me anything more. It makes it all very, 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 you know, tied up with a ribbon. And I don't believe that's the case. And now we've seen Matt Hancock resign. Well, let's hope Mr. Javid, who's now in charge, he's going to have to contend with COVID, NHS reform, the battle over pay, the appointment of a new NHS CEO, and not least the massive backlog of treatments. What we want for this borough, for our GPs and the GP that I'm connected to, that I'm a patient of East One, we want continuity of care, and we want to make sure our NHS stays public, it's not privatised, and we certainly don't want any of these contracts. So I'll stop there, Jackie.
Lovely. Thank you so much, Rabina. Thank you so much. It's really important to hear that really personal account, to think of what this actually means on the ground. And you're quite right. And I'm a GP, and, you know, traditional general practice has served us really, really well. As Louise talked about, the continuity of care and you know, the going out and visiting the elderly, everyone being able to access us. And the NHS has been so squeezed by this government, so squeezed, you know, over the last 11 years. And we hear so much about how the hospitals are in crisis, general practice is in crisis as well. And I'm not proud of the service that we're offering at the moment. I mean, and that again is, we need to be able to get the NHS invested in. It's the NHS 73rd birthday on Monday next week, and we're going to be having in London a protest outside the Department of Health. If any of you are in London, please come down and join us 6 p.m, because we have to have the NHS taken back into public ownership properly and invested in properly. Okay, so thank you for that. Just a couple of questions have come up before I bring in Antonio. This meeting is being recorded. I'm sorry, there was a problem with the Facebook link. I don't know what happened there, so apologies, well, actually not to all of you, because you've got in, so all the people who aren't here, who I can't apologise to, apologies to them, but we will be putting it up so people can watch it later. I think we probably put it on the Cllr NHS Public Facebook page, and we'll tweet it as well and put it on YouTube. Very, very quickly, to Tara Alec in the chat, it's never too late to campaign. Please get in touch with us. We're North East London as well, and I think you're in touch with some of us, so please get in touch with us. APMS, what does it stand for? It's hard to go into that now, it's quite technical, but it stands for Alternative Providers of Medical Services. It is what it says on the tin. It means that an alternative provider such as Centene or Atos, and it can provide the services, and they were brought in 2004 as the slippery slope towards commercialisation has been descended, and we've got much further down that slope since then. So we have to push the NHS back up to the top of the slope. Okay, so we've got 2 more speakers left, and then we'll open it up for a bit of discussion. So we've got Antonio Perez Iranzo, who is speaking to us about the experience of Centene in Spain. Antonio, I'm really sorry, I don't know the name of the organisation that you're from, so huge apologies. And if you'd just like to introduce yourself, that would be fantastic. I think we've made you a co-host so that you can share your screen. So if you could speak to us for about 10 minutes, that'd be fab. Thank you.
Yeah, can you hear me well?
Yes, you're fab.
Yeah. Hello, my name is Antonio Pérez Iranzo. I represent the Federación de Asociaciones para la Defensa de la Salud y la Sanidad Pública in España, which means it's a social platform of federation of different associations to the defense of the public NHS, kind of a public NHS in Spain. I'm actually talking mainly on behalf of Marciano Sánchez and Pedro Lorente, who are the real fighters, and they really know much more than I do, but maybe because I can speak a little bit more English than they can, because I have been selected and named as the talker. I'm a consultant in the Hospital General de Castellón in Spain, and also I'm a pediatric intensivist consultant at the Birmingham Children's Hospital in the UK. So I kind of know both systems. Just wanted to talk you briefly about our experience with the Ribera Salud experience, and therefore with Centene multinational. This model was born in Valencia in 1997 in the area of La Ribera. So that was the system. The name arises from the hospital that was created by Centene International. They also, it's not only, they not only run this hospital, but they also run three other hospitals in Valencia, 3 in Galicia, 1 in Madrid, 1 in Extremadura, and also we have known that they run 1 in Callao in Peru. They were trying to develop 1 in Montevideo that we were able to stop in cooperation with other associations there. They also done 3 laboratories in Madrid, Prague, and Bratislava, 1 hemodialysis center in Alicante. So what is the Cllr model? Well, I think I've been listening to your talks before, but essentially it's a public to private collaborative system in which the enterprise, in this case Centene, invests and builds a hospital, and in exchange they obtain the right to run this hospital for a certain period of time. In this case, there was an initial contract of 10 years, which was actually prolonged to 20 and 30 years. And it was not because they were doing well, but we believe that there were a lot of unknown and deep silent associations between different powers in Spain. In exchange of just running the hospital, they will receive an annual capital payment per theoretical patient. In this case, I think in 1999 it was around 250 euros per patient, and then the other option for getting money as well is just some payment per procedure as well. If they would treat patients for different areas, they would get an additional income. There are other variants for this as well. They've been trying to control the primary care, sociosanitary attention, and they also try to extend to other areas, for instance, in Galicia. So how do they make money? I mean, well, there are 2 options. So they get money for every possible patient that they would be able to treat. So obviously the way of making money in this option would be just to reduce the cost. How do they do that? Obviously, they were and they have been known to hire less nurses, less doctors, less skill, reduce the skill of the nurses. They had the full control of who they would hire and in which conditions as well, and essentially they would reduce the quality of some of the treatment they would deliver. And the other possibility for making money is obviously they were just attending, offering different procedures, and what they were doing was essentially to deviate these procedures from the public areas. So, for instance, it was very well known the case of the vaginal deliveries for children. So essentially, they started to promote these deliveries in Cllr, and essentially they hired a bunch of anesthetists who would deliver epidural anesthesia, and in cooperation with some political powers who would reduce the anesthesiologist in the public hospitals. Therefore, if you would go to Cllr, you would get the epidural guaranteed. So these had a call effect. So a lot of mothers went to Cllr and delivered their children there. And that resulted in an increase of the deliveries in Cllr to 37%, while the public hospital would only have an increase in the deliveries around 0.7%. And those that have been contrasted. They would also have some contact that happened, for instance, in Madrid with some call centers, medical call centers, which were also private. So they would get more patients deviated from the public system to the private hospital. In contrast, what they would do with other less productive activities or patients, those were not convenient for them. So those ones were deviated to public hospitals like Hospital La Fe of other ones. And there is an additional way that they would make money is just via pharmacy. So all the drugs were bought centralized via different intermediaries at lower cost. This is very interesting because essentially the B2B, which was the center for buying different drugs, now it's being sued and it's on court due to many irregularities. So essentially, they would just buy the drugs at lower cost and sell them at higher cost at the pharmacy, just like it would happen in a private pharmacy. And they developed very progressed techniques to hide the real cost and to hide the overall loss of money that they were just performing. What were the consequences for the public system? Well, the hospitals, those hospitals would have lower numbers of beds in relation to the covered population. And as I mentioned, in these private hospitals, there were lower staff ratios compared to beds or patients than in public hospitals. In Spain, in Cllr, for instance, there were 2.5 times less doctors, 2.2 less nurses, and 1.6 less health assistants, and 1.6 non-health workers as well. And they progressively would increment those costs, and they normally would be allowed to get a low per capita payments, which I think was initially 200. That was increased to 300 within time, and after some time, the cost increased 6 to 8 times the overall cost. In contrast, some of the beds were blocked in other public hospitals or just eliminated in order to have more patients sent to them. It's funny that you have mentioned, and actually I didn't know what was the translation of puertas giratorias to English. And actually you have a name for that. It's revolving doors. And we Spaniards thought that this was something that only happened in Spain, but actually I'm surprised to know that it also happens in the UK. And so the person who was, there was a nominated person in the Consellería de Salud that was supposed to monitor the results of Cllr Hospital. And guess what? That person ended up being the director of the Cllr Hospital 4 years later. So essentially, those companies, Centene, that's not really play clean. I can tell you a lot, and I could talk hours and hours about the corruption of our Valencian governments run by Partido Popular, and the way that this Cllr model was like the big ship, you know, like we call it buque insignia. So it was the mark of the Partido Popular. And it was clear, and has been shown later in trials and courts, that there was a illegal association of some of the people in the power with this company. So it's not a fair play. It's not just a laissez-faire, as the French say. Is really a fair play with a private company sharing profit with some corrupt politicians, like it happens here. For instance, the UTA Rivera Salud Association was mainly run by Rivera Salud, which owned the 96% of the holding, also by two small Spanish companies, building companies as well. And this Rivera 96% was obviously not other than Centene Association, Centene multinational. So how was the model reverted? There was a joint effort of syndicates, union, patients association, some political parties as well. I think we used the end of contract. That contract was prolonged. Initially, it was planned for 10 years, was prolonged for another 20 years. In the spite of the big expenses and loss of money and it was actually rescued by this that corrupt Valencian government. Essentially, we lost lots of money in that. But the politics in Valencia and the Valencian community changed. And as I said, as a result of this combined effort of different associations, in 2015, there was this end of contract was used as a narrative by this three-party meeting in order to finish with this contract. We must say that despite the fact that there was this end of contract, there were more than 100 judicial or processes, legal processes started. There was press campaigns against the process. The enterprise created a false social platform, a ghost platform, which kept organizing demonstration to keep Centene running Alzira. And there was even some international political pressure by the USA ambassador against the political Valencian government. And I can say that in the moment there are 2 other hospital reversion in process. So, as summarizing message, this Alzira mobile definitely worsened the assistance, increased the cost, and weaken the public sanitary system around it. It definitely puts the commercial interest up from the public health system and put our system in risk. And there are definitely alternatives for its reversion, but it requires a joint effort and a political effort. I think that's all from me, and I will be happy to take some questions. I think Pedro Lorente, who is my mentor in all of that, and he knows much more than I do. And I'm not sure if he would like to ask or to add something to what I say. Thank you very much.
Thank you so much, Antonio. Thank you so much for coming and for persevering with joining the meeting as well. That was really interesting, and it just goes to show, doesn't it, how these companies are they are global, they're multinational, and they're trying to get their claws in everywhere. So thank you so much for sharing your experience there in Spain. Okay, so we've come to our final speaker, who needs no introduction. We've got Jeremy Corbyn, who's the best Prime Minister we never had here, and it's really lovely to welcome Jeremy along to speak. And Jeremy's been really involved in this campaign as well, and has been really active on this campaign. So thank you so much. I'll stop burbling on, and yes, thank you, Jeremy.
Jackie, thanks so much. And thank you, Antonio, for what you just said about the campaign in Spain. Buena suerte los militantes de España para la salud para todo el pueblo. Okay, ¿está bien?
Thank you.
Jackie, this is a fantastic call, fantastic meeting. By my calculation, there's over 500 people at this event now online. Just imagine if we weren't in the middle of COVID, we were in a public meeting hall with 500 people, all pulling in the same direction on health campaigning. You'd get that sort of sense of solidarity and presence there. And so well done you on organising it, and well done everyone for being here today. There's so much could be said, but I'll try and be brief so we've got time for people to give their own points of view and their own experiences, which are there in the chat box. This is an incredible challenge to our NHS, what is now going on. I challenged the Prime Minister 2 years ago on this and saying, you're going to sell off our NHS to American companies. And he said I was scaremongering and talking nonsense. If anything, I was understating the case and understating what the threat was about. That was when I revealed the trade deal documents that he was negotiating at that time secretly with the United States. What they were saying was that any trade deal with the USA would involve the access to the UK health market. Well, they've already got access through the Health and Social Care Act and through the decisions made of Jeremy Hunt, of the succeeding health secretaries after that, including the unlamented Matt Hancock, who's now finally left office. And I sent a tweet out today to acknowledge Sari Javid taking over and ask him not to follow in the footsteps of the others and privatise the NHS, and also, while he's on with it, to resign from any banking directorships he might have. And that tweet has already had 2 million people look at it. And that I'm not interested in anybody's personal lives. I'm only interested in what they're going to do politically, what happens to our National Health Service. Now, GP surgeries are the ones at threat at the moment. I'll just say a word about that and I'll come on to a wider issue. One of the fault lines in our NHS was the deal done in 1948. We all know the reasons why it was done. The history shows the pressures that were on the government at the time, that were on an Aaron Bevan at the time. And that was to give the GP practices essentially a contracting relationship with the National Health Service. And for most of the public, most of the time, most GPs, as far as they're concerned, are just part and parts of the NHS, just like anybody else. They don't actually often understand what the difference is. But it's when companies begin to get involved, it's when companies take over, it's when the issues of ownership of property and control of property of GP practices, and then the wish of local health authorities to have wider issues like walk-in surgeries, wider practices and so on, that it becomes very apparent that you're actually dealing with, in often individual cases, the private sector. But we now have this takeover of our GP practices by Centene, otherwise Oprah Rose. And there is one in my own constituency, it's been taken over. I've said this before, so others will have heard it. We had a salaried GP practice on Hanley Road in my constituency. It's just quite near my office, actually. And I was very proud of that because I think salaried GP practices are the direction we should go in. A doctor should be employed by the NHS just like anybody else. And therefore, their loyalty lies totally with the NHS, not with developing a small business of their own. This was then taken over by Centene, and to her eternal credit, Angela has taken out a legal action against them. And I was with her this afternoon. We were talking about the progress of this and the crowdfunding that's helped her to take this action out. She's a local councillor, but also sadly has MS and therefore relies very heavily on her GP practice. And she, like all of us, utterly resent the idea that her GP practice is now run by an American healthcare company whose interest is not primarily the health of the people of Holloway. Their interest is the profits that will be handed back to their shareholders, in this case, in the United States. And so it is about challenging it at that legal action that's taken, and that I'm sure we can all get behind. And there is dozens of other cases. And I was listening very carefully to what Rabina was saying earlier from Tower Hamlets, and she was saying, like me, she didn't know it was happening in her own very own doorstep. I was in exactly the same position. The first time I heard that a private company had taken over a GP practice in my constituency was when I read about it, because campaigners told me they just discovered this was going on. And then we came on the demonstration that you organised, Jackie, outside their head offices on that beautiful, if very cold day. Mm-hmm. And so it is up to us to campaign on it, putting the pressure on legally, but also campaigning for the whole principle of our National Health Service, because it is under threat. It's under threat like it's never been under threat before. The staff have dealt with COVID brilliantly. The care workers and everybody else, incredible efforts that have gone in, and all the volunteers and everything else. And what's the reward? More privatisation, more handing over contracts to Serco and everybody else, which diminishes our ability to deliver a holistic health service. And I was at the demonstration organised by People's Assembly and a number of unions on Saturday. And the point I was making was that we have to defend our NHS, of course, and we all do that. That's why we're here. That's what gets us out of bed in the morning. That's what keeps us going. But it's not enough. We get people behind us when we defend, but also when we demand. And so I hope that what I heard earlier that others were saying, I think it was Louise was saying, that there's to be a sort of more comprehensive approach put forward of what we demand from the NHS in the future. And I absolutely support that idea, because I want to see an NHS free at the point of use. I want to see it prescription charge free. I also want it to be extended into the issues of social care. As I pointed out to the rally on Saturday, probably half the people that filled Parliament Square last Saturday would, at some point in their lives, need some form of social care. It might be a daily visit from a care worker. It might be something even bigger than that, permanent care worker, care help, and so on, all those things. It should not be decided by a postcode lottery. It should not be decided by the value of your house. It should not be decided by the ability of your children and family to pay for your care. It should be part and parcel of the principle of healthcare free at the point of need. And as a country, we could well afford to do that. We can't afford to do it unless we have a better taxation system. We can't afford to do it unless we have some reallocation of spending priorities in government. And I can think of lots of areas that you could reallocate that. But it is about that, and it is about funding of mental health and so many other things. Our call today is a call to action. All of us to take action in our own communities this weekend in defending our NHS, stopping our GP practice being taken over by Centene. And I see there's going to be a demonstration in London on Saturday. Sadly, I cannot be at that one because I'm going to be at a demonstration in King's Lynn, supporting their campaign to defend the health service there. But I think what you said earlier, Jackie, about a big NHS Day demonstration outside the Department of Health next Monday night, 168 hours from now, would be a really good idea. And there's no better place to demonstrate. It's in Whitehall. There's loads of journalists around. There's lots of TV nearby. Let's do it and show that we are actually determined to defend our NHS. It's not for sale. It's not going to be put on sale so long as we're around, and we've got to defend it at every inch of the way. And it means, I'll finish on this, saying to patients when they go to their GP practice, watch it. Your practice is on sale. Watch it. Your data is about to be given away by the NHS to commercial purposes that will use that data to further invade the precious space, which is our NHS and the medical research which our NHS is capable of. And absolutely last from me, we invested, the public, a lot of money in the vaccines, yet the intellectual property is owned by somebody else. Big Pharma is making a lot of money in this country and even more all around the world. There's never been a better time to make the case for universal health care via the World Health Organization on a global basis. And let's defend what we've achieved in our NHS, but make it even bigger and even better than it already is. But we're not going to do it if we just talk to each other. We're going to go out and talk to everybody else. Jackie, thanks very much. Sorry if I went on a bit too long.
Nope, that was perfect. Thank you very much. That was absolutely great. No, you didn't go on too long at all. And absolutely a call to action. We mustn't talk to each other. There are nearly 500 people here. That's absolutely fantastic. And I'm sorry about the Facebook link because I think there would have been more people there too. But we're going to put the meeting on we're going to put it on social media. But absolutely, there'll be things happening near you on Saturday. If you don't know about them, Cllr NHS Public website, go and have a look for your local activity. But next Monday evening, 6 o'clock, outside the Department of Health, there will be a demonstration. Please come to that. We'll put more details out. We'll circulate details, but there will be a demonstration outside the Department of Health next Monday, the NHS 73rd birthday at 6 p.m. So if you're in London, please come. Okay, so thank you to all our speakers. Now we've got probably about 20 minutes for a bit of discussion. So if people want to put their hands up, and I'll call you. I probably won't be able to get to all of you, so I apologise in advance because there are a lot of people on the meeting, but it'd be really interesting to hear what people have got to say. So first of all, I've got Ray Gandy. So if one of my assistants could possibly unmute Ray Gandy, and can you try and keep your comments succinct? If you just keep them to about a minute, that'd be really helpful, and then it gives us a chance to hear from more people. Thank you.
Thank you. I put my comments on the list of people who have made comments. It's although we talked about Centene today, my experience has been one of a company called Spectrum Health, which is an American company based in Chicago, who have taken over a general practice which I belong to. And my experience has been a dreadful experience of GP, a primary care practice, actually not providing the core services, where most of the patients are not been seen face to face by a GP for at least 18 months. Thank you.
Okay, thank you very much. Thank you for that. Next, I have Sue Mitchell. Somebody could unmute Sue. Thanks. Sue, do you want to go ahead? Ah, you're still on mute. Can somebody unmute Sue? Is that all right? Or invite Sue to unmute herself, and then. Ah, there you go, Sue, you're unmuted.
I live in Bradford, West Yorkshire. I'm a member of a group called Aging Without Children, which some of you may be aware of or not, but we're looking into the problem of people who, and it ties in with what you're saying about elderly people not having access to the IT technology, because we're looking into the problem of that there are a lot of people out there who have no support network, they don't have family, you know, they don't have children, or the children are estranged, and they're getting elderly, and who sticks up for them? You know, in this sort of situation, if things are being imposed, they're potentially not in a position where they can advocate for themselves, sort of thing. So it is quite a concern. The other thing I was going to say is, I mean, I struggle with some mental health issues, and I found it hard to take all the information in. Is there anywhere I can go which all this information and these links and everything else you've been talking about, I can actually get access to that? Because I was scribbling away, but I just lost track completely. Okay.
I would say keep our NHS Public website, the We Own It website, and the 999 for the NHS website will have lots of the things. Oh, and Health Campaigns Together, which is umbrella, and it has that has everything. That's a really useful one. Okay, thank you very much. Okay, thank you, Sue. So the next person I've got is Sarah Patel. Then I've got Jan Kilsby. So Sarah Patel first, then Jan Kilsby. Please, Sarah, you're unmuted. You can go.
Oh, hi, everybody. I just wanted to know that how do we find out when the contracts are up for renewal in our local area? So, you know, who do we contact? Do we ask the CCG, or do we have to ask for a freedom of information, or how do we know? Because obviously I don't want a GP surgery to suddenly become under Centene without, you know, we need advance warning. So how do we how do we find out when these contracts are up next?
Right, I would say CCG, and they should, and just write and ask them. They should tell you, but if not, a Freedom of Information Act, definitely. Yeah. Lovely, thanks. Okay, I've got Jan Kilsby followed by Lucette.
Hi, I'm sorry I'm hiding. I'm just not very well today, so I've kind of been up and down, so I do apologise. I haven't got coronavirus, just to let you know. I'm part of the original Save Charing Cross Hospital campaign team that I came on board because I've got a child on their second kidney transplant, and I have known the Imperial Trust hospitals for nearly 20 years and the miraculous work that they do. Now I'm getting very concerned about the GPs. I grew up in Barnes. We came from just a normal working class family of Richmond upon Thames, and it's now an extremely rich borough. I'm 61, so I'm going back a few years when it was a very mixed community. And I'm noticing that more and more practices are going completely private. And this is a huge worry to me. I just want to know, does anyone else know if these of any, you know, they're not even being taken over by American companies. They are just turning into their own private practices, and that is a huge worry. There's a particular practice in Castle in Barnes that's gone private. So I'm just flagging up really because it worries me.
Thank you very much. And absolutely, it is very worrying. It is very worrying, which is why we need to act. And I think somebody in the chat put earlier, not everyone can demonstrate, and I totally understand that. But you know, get involved with your local group, write to your MP, write to your councillors, go to the health scrutiny meetings. There's so many ways that people can be active. So it doesn't just have to be going out and demonstrating, and be with your local group as well, because there's more. There's solidarity and builds confidence if you're campaigning with other people. So those things are all worth doing. I've got Lucette and then John Dale, please. Can we unmute Lucette? Thanks.
Hi. Yeah, I just Louise Irvine said something about Centene can make money out of data. We as a campaign in Eastbourne, we've been encouraging people to opt out of the data going over to NHS Digital. And I know like a lot of people have been very cynical and actually told me that, well, they don't think it's worth doing because they think it's already gone over, it's already everywhere. I have to say, I sort of like share their view as well. I sometimes wonder, I mean, why are our GP surgeries not writing to us and letting us know that we actually should opt out if we don't want our data being transferred? It sort of it makes people lose trust with their GP, and their GPs should be out there telling people what's happening. And it would be really helpful to our campaign if actually the GPs were on our side. But sadly, it doesn't seem to be the case. We've written to the GPs asking them to let the patients know, but actually none of the GPs have even replied to us. So I don't know if anyone who's a GP could answer that.
I'll try. I'm a GP, and absolutely, it's a huge breach of trust, and it's really, really worrying. We got 3 weeks' notice about, and we're trying to deal with COVID, and I mean, I just, you know, call me a cynic. I think it's probably deliberate, and so there's now been a delay, but I quite agree with you. It's you didn't say this, I'm saying this. It's kicking the can down the road, and data will be shared on the 1st of September if people don't opt out. And you know, lots of people won't know about it, and especially if English is not your first language, or you're not tech savvy, or for whatever reason you might not know that you should opt out. But watch this space. There's a campaign coming, there's a petition coming, and there is information coming for GPs. I'm involved with a couple of GPs locally who are about to push something out in the next week or so. So watch this space. But actually, you know, absolutely agree with what you said there, Lucette. It's a huge worry and a huge breach of trust if people share their data. Right, I've got John. I'll hand to Louise. Louise, do you want to come back on that? Can we unmute Louise, please?
Yeah, just quickly, yes, in our practice, I got one of our administrators to send a text message to every patient to tell them this was happening, and we made sure we put something on our website with a link to the opt-out information. So practices can do that. We did it quite easily. You need to go through your maybe practice patient group. Keep hassling your GP. I mean, they're busy, and you know, but you know, it will eventually go through to them. All they need to do is send out messages to their patients and put something on their website. It really isn't hard. Keep on hassling them, keep on at them till they do it. That's what I think.
Thank you, Louise. Lovely. Okay, thanks. I think it was John Dale next, and then Richard's iPhone. John Dale.
Thanks, Jackie. I'm the Secretary of Unite Nottinghamshire Health Branch, and I would like to endorse everything that Richard said about the situation in Nottingham when he opened the meeting. I'd just like to add that Centene is not the first American corporation to try to suck money out of our NHS. Back in 2005, United Health, the biggest health corporation in the US, took over a GP practice just a few miles from where I am now, Langwith, a small ex-mining village in Derbyshire. And at the time, the advisor to number 10 on health was Simon Stevens, who later went on to become a vice president of United Health, before then coming back to become head of the NHS under Cameron. The record of United Health in Langwith was as bad as has been described by other people in this meeting. You could never get a GP, there was no continuity of care. In the end, they packed up that contract. It was clearly being taken as a loss leader in order to try to get further practices in the future. But the point that I'll finish on is that all that was taking place not under the Tory-led coalition government or the Tory government, that was under Blair's Labour government. And I think tonight's meeting with all the excellent speakers shows that to save our NHS, we need a government that is committed to the principles that the NHS was established on. We don't have that with the Tories, we never will have. We don't have that, we didn't have that under Blair's Labour, and sadly, we don't now have Corbyn, Jeremy and his supporters leading Labour either. Trade unions, health campaigners, we need a party that will fight for a free, universal NHS run in the way that Nye Bevan originally envisaged. And that's part of our campaign. Thank you.
Thank you very much, John. Thank you for that. And Richard's iPhone. If you're there, Richard's iPhone.
Hi, Richard Langworthy. And
hi.
I just want to know how we can actually get it into people's heads that we need to rise up and save the NHS. Not enough people seem to be aware of it. My parents are denying that the NHS is in any danger, and my brother uses private healthcare. How can we actually save the NHS once and for all after lots of social media and Twittering and Zoom meetings? And I wonder if these protests are actually going to lead to anything.
Thank you for that. I would say, as Jeremy Corbyn said, we need to get out on the streets and we need to make a big fuss, and we need to do all of those things. It's, you know, it's a classic phrase, isn't it? If you don't fight, you won't win. If you fight, you might win. You know, at least you stand a chance, and we have to stand up and do that. And you know, the NHS was born out of the ashes of the Second World War, wasn't it? When actually the debt that we had as a country was much greater than it is now. And if after the Second World War we can build an NHS, they can certainly build and afford one now. So I think we just keep on at them. But thank you for that. So the next person I think I've got is Pam Raymond, followed by Malcolm Law.
Hello. Hello, I'm Pam Raymond. Can you hear me?
Yeah, we can hear you. Thank you, Pam. Go on.
I've been campaigning for many years, and I used to go on the streets and people thought I was a mad woman saying that the NHS is being privatised. I've been going out, I've been out 2 or 3 times now in recent times since the pandemic. I've made my own leaflets and I've printed them out, and I've had quite a bit of help, fortunately, from various groups I'm in, and people are definitely seeing what's happening. Before, people used to say I was mad. Now people are saying, why haven't I heard about this? Because they're obviously seeing what's happening in GP practices, and I think that's really got people going. So we need everybody to go on the streets in every town, in every city in this country, and then people will fight for it.
Thank you very much, Pam. That is absolutely, couldn't agree with you more, and thank you very much. Okay, I've got 4 more speakers left. I could probably get you all in if you're all lovely and quick. So I've got Malcolm Law, Annie, Liz Silver, and then Shirley Franklin. So Malcolm Law, please. There you go, Malcolm.
Oh, hello. I've finally got, can you hear me?
Yes.
All right, I've finally got it unmuted. I've been campaigning for the NHS with a local group. This is in York for the past 11 years. It's a hard battle and we're still not convinced. We still believe there's a lot of people not convinced. Come back to GP practices. Our local ones, 11 of them are in a federation under something called Nimbus Care Limited. This is obviously, it's a federation of the GP practices. I mean, what should we be afraid of here? I mean, they've been running a vaccination centre at a place called Askham Bar, which is in York, successfully. So, but I am concerned that they are a limited company. And there's a picture of Professor here I've got on this. I don't even see this. This is how I got to know about it, is in this magazine which comes through our door. Not directly, no letter or anything from our local surgery, but through this magazine. To me, that's bad. What should we be afraid of? Anything?
You've gone mute again, Malcolm. Have you finished? Okay. All right. Thank you very much. Thank you very much for that. Okie doke. Who did I say? I think I said Annie next, then Liz. Thank you. We just need to unmute you, Annie.
Hello, can you hear me?
Yes, yeah.
Yes.
Yeah.
I only want to know where I can find a list of these organizations who are trying to privatize the NHS, and also a list of websites that would have information.
Okay.
Can you produce a list?
Okay.
Where could we find it?
Okay. So what we've done is I've asked if the links can be put in the chat, but if you can't see them there, don't worry. I think the best thing to do is to go to Health Campaigns Together. If you go to Health Campaigns Together, if you just Google that, they've got a really good website, and they, yes.
Good, thanks very much. Health Campaigns Together.
Exactly, just Google Health Campaigns Together and everything will be there. All right. Okay, thank you for that. Okay, I've got Liz and Shirley, and then I just want to bring the speakers back in for a minute each. Liz Silver. Can we unmute Liz Silver, please? What's happening here? Can we unmute Liz Silver? If I ask you to unmute Liz, maybe you can unmute yourself.
Is that okay?
Oh yeah, is that you, Liz?
Right.
Yep. Yeah, go, off you go. Yeah.
Thanks. I just wanted to say that the speakers tonight came up with some really interesting things, and thanks for all that. The integrated care system was mentioned a couple of times, and Jeremy Corbyn also mentioned the links with social care. And I just wanted to share something that I was in a meeting recently with the lead councillor for my local authority who leads on health and social care, and we were talking about the ICS and how big an impact that could have on the lives of disabled people and independent living, and the potential privatisation about it, and accountability of health services in connection with social care. And her response was that whilst the local authority would do everything it could in terms of tweaking things locally, that the ICS was going to be a statutory requirement, and so the Labour Authority would have to go along with it, and they'd got no choice in that. And it just sort of seemed quite depressing. I suppose in some ways she was right, because the local authority, like so many Labour-controlled local authorities, aren't going to, I don't know, stand together and resist kind of what's happening at government level. But it was just her response really was that, oh, well, it's going to be there. We're going to have to comply with it. We'll do what we can locally, but that might not be very much. And anyway, just wanted to share that.
Thank you. And I think a lot of them say that, but we have to show them there is another way. So thank you for that. Okay, I'll take Shirley, then I'm sorry, other people are putting their hands up and I'm really sorry, but I need to take Shirley and then just bring our speakers back for a minute each as well. Otherwise we'll run over. So apologies to those of you who wanted to speak, but I haven't asked. So Shirley.
Right, people are saying, how do we win? And one of the things that's absolutely key is information. It's really, really important that people do have, because it feels like people are not quite sure what's going on. So if it's going to be on health campaigns together, that's great, but everybody needs to know about that. And everybody needs to know about that. We need to use social media very big time. Jeremy Corbyn was at the heart of the campaign that we were successful in the Whittington Hospital. We took to the streets, we bombarded board meetings, we did all those things, but that was when we were going to lose our hospital. It's quite difficult to fight on this issue of privatising GP surgeries, but actually I don't think it would be so difficult if we actually fought for our NHS, because if you think about all the contributions tonight, it shows that our NHS is at risk, and that's what we need to talk about. It isn't just about privatisation, which does mean the loss of doctors, the loss of proper care and that sort of thing, but it also is all those other things that are going to have an impact on our healthcare, and it's how we got to fight. And then we do have to take to the streets. We just take to the streets as members of the public, but we also ask our trade unionists in hospitals and actually everywhere else to take action. We're not going to win unless health workers actually kind of, I don't mean to be horrible, but wise up. You know, they cannot have trade union leaders they know can't take action. It's really, really important that we're all in this together. It's all of our NHS, and people need to fight together and fight on the streets and fight in the workplaces, and that's how we'll save the NHS.
Thank you very much, Shirley. And that, yeah, absolutely a good way to finish off this contributions from the floor. Thank you very much indeed. And as I say, apologies to those of you who had your hands up and I couldn't get to. So a minute each for all our speakers, and thank you so much for coming, everybody. Thank you so much for coming and taking part in the meeting. A special thanks to our speakers, and also thanks to my technical team who are behind the scenes but who don't get the plaudits. So thank you to them very much. This is Candice, Maggie, and Tom and Amy. So thank you very much to all of them. Right, so if I'll take the speakers and take you in the order which you spoke, if that's okay. So Richard Buckwell, if we can unmute Richard, if you've got 30 seconds to rouse us.
Okay, most definitely. You can hear me all right, can you?
Yep.
Good. Well, the question's already been asked and answered, but you can most definitely win. I mean, we've had quite successes against some really big organisations. As I say, we got rid of Cllr in Nottingham, we got rid of Circle, and I think on doctor surgeries are local to you. And, you know, if we get the whiff of a surgery being taken over by Centene, and people after tonight know about Centene, you know, I'm sure we can get together a local protest. So yes, go out there and do it. And the other thing to say about trade unions, I think dead right there. I'm really pleased to say in Nottingham, the march and rally this Saturday being organised by local trade unions and talking about the local services and the national services as well. So we need to work together on this, and our successes have been because of the involvement and unison and Unite particularly. I'll finish it there.
Thank you very much, and thank you so much, Richard. Okay, Louise.
Yeah, thank you very much. Yes, definitely. If you fight, you can win. We in Lewisham, we fought on, and we saved our local hospital. We saved Lewisham Hospital with a big mobilisation, and we had to keep mobilising. This Saturday, 3rd of July, there are events across England in 50 different places. And if you want to find out all about that and how you can get involved, please look at the keepournhspublic.com website. It's got everything on it. about this campaign. Somebody asked what should he be afraid of with what's happening to practices, and certainly Centene isn't the only issue. You know, practices really are struggling, and they've been forced into these federations, partly because they're struggling with finances, they're struggling with staffing. So supporting general practice in general is the way to help stop them feeling they have to be surrendered to the corporations. Jeremy was right that independent contractor status is the Achilles heel of general practice. I mean, it was okay for the first few decades. In fact, it didn't really matter because GPs provided a good community-based service, but it was the way in for the corporations from 2004. So, I mean, while a future NHS vision of a future NHS we'd like might include creating a salaried GP service, which I think would be a good idea. That's not really on the cards at all for the time being. I think now even reverting to the traditional GP system where you had community-based GPs that provided continuity of care would be a real step forward, and taking them out of the hands of the corporations. And I think that's a realistic goal for now, because people can understand that, and it would set back privatisation a lot. We can tackle the issue of the nature of general practice when we have the time and we have the kind of government that might help us to do that. But for now, I think we can campaign realistically to bring general practice out of the hands of the corporates.
Thank you very much, Louise. Okay, Rabina. I can't see Rabina. Can we unmute Rabina if she's... Oh yeah, great.
Oh, sorry, am I on? Yes, I am.
Yep.
Thank you, Jackie. Oh God, I need to get rid of this now. At the burden of this new technology, we still have to get used to it. I wanted to, I heard a lot about not giving up and about campaigning on what we could do. Well, you know, there's me, my yellow scarf sitting in front of them, a Lib Dem councillor. Now, why would she be here amongst you all? Because I care about the NHS. I care about our health. I care about my health, my children's health. I care about the elderly person who lives up my road, his health. I care about our aging population. They need good social care. They need people like us to care about them and make sure that their voices are being heard. And I tell you one thing, this government needs to realise that you can't be the person who never gives up. And that's all of us on this call. That's me. That's you, the GPs, all of us, because we care enough about the NHS, and that's why we shouldn't give up. And I've had my own sort of political problems in my life, and one thing I've realised is that sometimes what you have to do is you take a step back, you take a bit of a rest, and then you keep going, and you keep going, and you never give up. Because when you hit that road, you know that something will come about. You've heard all of these things, that all these successes that have happened. Just one example, East One Health. There was a couple of people standing outside, and then another couple of people came forward, another people came forward. It can happen. And I really urge you all, please don't give up, because the NHS needs you. Our population needs you. Our elderly people, our families, people who are using the maternity care, people like Bangladeshi women, Black women going into labour, GP, nurses, all of them, they need us. So please, I'll be there with you all the way.
Fantastic, Rabina. Thank you very much. And that, yeah, very, 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 very inspiring. Thank you. Okay, so Antonio, did you want to speak, or have you got, is it your colleague Dr. Lorente speaking on your behalf? Because I think you've been asked, are you still here, Antonio? Do you want to unmute?
I'm still here, of course. I am.
Oh yes, okay, yeah, okay, yeah. Go ahead. Yes, sorry.
No,
go ahead.
Unless Pedro, are you there? Do you want to say anything? I think we work hard towards the reversion of the model, and this. I mean, my country has had a big tradition of support of the public system. We really work hard. We have an overall hope and to push our public system forward. And I think as I said before, there are three main items that you guys need. I think to get these results and take these multinationals out of the scene. And the first one is obviously join forward and sensibilization of all the professionals, health professionals. Second, the population has to be with you, and they have to be informed, and the public opinion needs to support, and then they need to know all of this, what is happening. But nothing, I mean, really what it changed and what it helped in our example was mainly the political power, and we got an alliance of 3 different progressist parties that managed to unify all these 3 items and then get rid of the reverse in action. So, I mean, good luck, keep the faith up. Thank you.
Thank you very much, and thank you so much for joining us this evening. Really great to have you here. Thank you. Okay, so and finally, I'd like to bring in Jeremy Corbyn to rally us all. Thank you.
Thanks, Jackie. I'll be very brief because we've had a very good but quite long meeting, and I agree with what the fellow speakers have just said, absolutely. And Rabina, no, we're not going to give up. Nobody's going to give up, because we love our NHS, and we love it for the principle that it is healthcare free at the point of need for everybody. One of the most inspiring things about seeing a baby born in an NHS hospital is the first thing they get is their NHS number, healthcare for the rest of their lives. But it won't be there for the rest of their lives if we don't defend it, because those that want to privatise and take over our NHS have stopped attacking the principle of universal healthcare provision because they realised that was very unpopular, and instead have started to destroy the NHS from the inside by internal markets, by internal tendering arrangements, by the contract culture that goes with it, and by selling off or hiving off or contracting out whole areas of service. And that is the absolute danger to the NHS. The NHS could end up merely being a badge that gives you access to a succession of private sector deliverers. And behind that will be rationing of medicines, rationing of supplies, and you'll be invited to pay for an enhanced service if you can afford it. That's the whole direction in which the thing is going. But the support for the NHS is higher than ever within our society, as people have seen the value of it during the COVID crisis, and they've seen the value of it in so many ways. But provision is not equal. The levels of health inequality are huge. Life expectancy differences are huge. Life expectancies and healthcare between communities is huge. All these things have to be addressed. The private sector are not going to address them. Privatized GP practices will complain about excessive numbers of patients wanting things because there is a public health issue in the area, high air pollution levels, or whatever else it happens to be. So it's that principle of universal. But to win this, it's got to be, as I think Shirley was pointing out, completely locally based, aggregating up to a huge national campaign. I'll be in King's Lynn next week, and I'm going to Nottingham the week after that, and so on. I'm doing a lot of travelling around. And in all of the places I go, I'll be saying, well, where's the local health campaign? What are we doing to bring people together to defend our local GPs, defend our NHS locally, but above all, make demands for the future? And so we're not going to have it. We're not going to win this on a plate. Nobody's going to hand it over to us. We're up against some very big and very, very powerful forces, but we can defeat them. We can defeat them by protecting our data so it's not sold on to the private sector. We can defeat them by protecting the principle of GP practices being part of the NHS, not part of some global corporation's enterprise or empire. And we win on those, and we win on a lot of other things. But you have to excite people and inform them. I remember when we completed the campaign on defending my local hospital of Whittington, Shirley Franklin, who was absolutely central to all this, and I pay huge tribute and congratulations to her. She said at the rally, said, you know what, if it had been a campaign in defense of the mental health wards, would you all have been here? We all know the answer to that question. Defending an A&E and a hospital is tangible, it's obvious, it's clear. Defending who runs and owns a GP is not so obvious and not so clear to the people that use it, but it's actually just as important. Just as important. So it is up to us. Information out to people. And it's never been easier. Social media is there. All papers, all local papers and everything else are online. It's never been easier. Let's use it. Use the technology to our advantage and win. Thank you.
Right, thank you very much. Thank you for that rallying end to the meeting. So yeah, thank you so much everyone for coming. So basically join us on Saturday, join us on Monday outside the Department of Health at 6. Join your local group. If there isn't a local group, set one up. And that's how we're going to win this. So thank you so much for coming, everybody. I'm sorry if it's run over a little bit, but thank you to all our speakers, and see you all on the streets. Okay, bye.